Hey guys, this is Josh, PTA over at Crane Rehab. Today we're going to go over some basic lower extremity exercises. This is going to be a few things that most people coming in are going to have to do, so a few good ones to work on. First one we're going to do, just some basic heel slides. We're going to set up a board, just something that they can slide on. Sometimes the mat is a little too cushiony. So we're going to get the board all the way up close to them. We want to give them good room to work with. We're going to take this band, loop it over their foot, and we're going to give them the straps. Now, most people doing this, they're going to come in either total knee, total hip replacement. So we just want to work gently, just pulling up whatever they feel comfortable, and then they're going to come back down. Now, as they get a little bit more relaxed, maybe pain's an issue, they'll do a little bit more. And all we're gonna do, we're gonna set them up most of the time for 3 minutes, let them do all the work, and they just pull as far back as they feel comfortable. Next, another important exercise we're gonna do is just a straight leg raise. So what we're trying to do, first we're gonna have them set up laying down right here. Opposite leg is gonna be bent. We're trying to get a good quad contraction. So we're gonna make sure they're squeezing right here, and then they're gonna try and raise their leg up. Only has to come up even with the other leg and then back down. And I want to make sure it's nice and controlled. Keep going. With this also, we're going to make sure that this knee is straight. So they should be using this muscle right here. Another important exercise is going to be sideline hip abduction. So what we want to look at right here is we want to make sure that they're straight. So if they even bring your shoulders back a little bit. So shoulders, hips, ankles should all be in one line. Bottom knee is going to be bent. From here, they're going to keep their hip facing the ceiling, and then we're going to try and lift that leg up as much as they can, and then come back down. Now you really want to watch when people are doing this, so we're going to try and keep that hip up. A lot of people are going to tend to rotate back, which is a compensation, so we want to just make sure we remind them to do that. What they'll also do is when they start the movement, they'll turn their toe up and try and pivot their leg. Want to make sure we're leading this movement with the heel. So we're coming up and then back down. So 2 compensations, rolling the hips back or raising the toe. All right, so one of the things that you may see with hip abduction, some people can't do it on their side at first. So you can modify this by putting them in supine when they're laying on their back and actually have them on a slide board and just come out and then back in. This reduces the force of gravity. They can still get stronger in this position. Do this for 1 or 2 sessions and then try to go back to the sideline. It'll be hip extension. So what that is, we're gonna set our person up in prone. So laying on their belly. One of the best things to do for this is just have their feet hanging off. It's a little bit more comfortable for the person. And then what we're trying to do is we're trying to get an activation here at the glute. We're not trying to arch the lower back. So if they try and do too much movement, they'll kind of arch this section. Just kind of watch that. So all we're gonna have them do, bring your heel straight up to the ceiling and then come back down. And at first, if it's not a lot of movement, that's fine. We're just trying to get this to work. We're not trying to arch anything right here. One of our commonly confused exercises is going to be hip adduction sideline. So adduction, what we're going to do, top leg is going to be bent over, and we're going to try and actually bring this bottom leg up towards the midline of the body and back down. Now this is a weird position for the patient. It's also just a little different. So you may have to take a little bit of time and explain what's going on. But we're just coming right here. Yet again, some people may not be very strong right here, so you may have to help them. Or just not have a lot of range of motion at first. Top knee bent over, bottom leg coming up. Important movement for our lower extremity is going to be a SAQ or a short arc quad. How we're going to set this up, we're going to set them up with a bolster underneath their knees. Again, we're going to work on squeezing that quad, except this time they're just bringing the bottom part of their leg off the mat and then back down. And we'll really want to make sure quad is activating. Now, when we talk about open chain versus closed chain, This movement right here is going to be an open chain. So now when we're talking about open chain versus closed chain, this short arc quad, we're going to contract the quad, lift up, is going to be an open chain movement because the distal part of this is not affixed. When we look later, we'll look at a TKE. The distal part will be fixed, but we'll still be using the same movement. Now we're going to work on doing bridges. When we're doing bridges, what we're going to have them do, knees are going to be bent as far back as comfortable. Don't have to be all the way back here, but if you put them too far out, it's not going to work as well as we want to. From here, we're going to have them tighten their core, so pull that belly button in, and then they're going to actually try and lift their hips up off the mat, and then come back down. Ideally, we want to see those hips just come up to where there's a straight line to their knees, and then back down. And you may see this movement where somebody has a band around their knees where they're pushing out against the band, or similar thought process except a ball in between, and they would be doing the same thing, pushing their knees into the ball and doing a bridge. So it may change a little bit. Another good hip exercise is going to be our clams. So what we're going to do with the clam, we're going to have a band right above the knee. From here, we're going to make sure, again, they're not rolling back. They're going to keep that hip facing up towards the ceiling. Feet are going to stay together. Knees are at about a 90-degree angle right here. And then we're going to try and bring that top knee apart. So bring those knees apart for me. Good. And then come back down. And again, make sure this hip isn't rolling back. All the movement should come from the hip, from the knees. So a natural progression from short arc quads is going to be long arc quads. So this one we're going to be sitting off the edge of the mat. And what they're going to do again, squeeze the quad, try and bring this foot up and back down. We want to make sure that it's nice and controlled and they're activating here as much as they can. Getting this kind of hold at the top just for a second, come back down. Some patients may experience a little bit more pain. This movement versus the short arc quad puts a little bit more tension or pressure on that patella, that kneecap. So if that happens, just let the therapist know and we can kind of modify it from there. Talking about the short arc quad versus the TKE. So if we notice with the short arc quad, our foot was hanging in the air. TKE, our foot is going to be stabilized on the ground. And we're still going to do the same movement. We're going to try and activate that quad and push the knee back. So we're going to bend it forward, and then squeeze the quad, push back. So same movement, but two different uses of it. One's going to be open chain, the short arc quad. One's going to be closed chain, TKE. Crane rehab. Today we're going to go over the total ankle exercise. So what we're going to do, we're going to grab one of these bands with a special loop around, get a bolster to put underneath their ankle, and we're going to do this move. We're going to do this 4 ways. So the first way, you're going to set them up. Band's going to be right here. They're going to pull their toe back towards them. Good. Most of the time, you're going to do about 30 right here, but just check the form for any. All right. After that, now I'm gonna pull the band towards me. They're gonna try and pull their ankle only away from me, not moving at the knee. So all the motion should happen right here. Let's try that. Good. Give me a couple of them. All right. And then show me what they would do without, like how people do it wrong. So some people, they'll turn their knee. This isn't as much of an ankle movement. So you want to keep this still. All the movement should come from right here. Good. Moving on. Next, we would take the band, give that to them. Like to tell people, just push down like they're pushing on a gas pedal. So they're going to pull the band to them and then they're going to push their toe down. And last but not least, stop real quick. Last but not least, we're gonna go in. So pay attention towards me. They're gonna pull away again, not moving at the knee, just moving the ankle.